Hi, my name is Edna Hajdarevic and I'll be discussing hepatitis C and why it is important to address. Hepatitis C is a virus present in the blood and causes inflammation of the liver. The virus's main mode of transmission is through blood-to-blood contact. For example, it most commonly is exchanged through unsafe practices such as sharing unsterilized needles, other drug-injecting equipment, or sharing unsterile tattoo, piercing, or acupuncture equipment. Other forms of transmission also include sexual transmission, household transmission, such as the sharing of razors, toothbrushes, and nail files, non-sterile medical or dental procedures, and during pregnancy or childbirth. The hepatitis pathogen either induces acute or chronic symptoms, with an estimation of around 211,000 people developing chronic hepatitis C in Australia. The hepatitis C virus is a single-stranded RNA molecule and has at least 6 different strains of genotype subgroups between each genotype. When the pathogen enters the body, it causes the most damage when it reaches the liver's cells, known as hepatocytes. Using chemicals in the hepatocytes, it replicates and reproduces itself. This invasion further induces the body's immune response. However, the immune system is unable to destroy the virus on its own and only further causes chronic inflammation in the liver, where the liver cells are destroyed. Over a period of time, the formation of scar tissue may develop. This is also known as fibrosis. Hepatitis C is an important disease to address, as the state government of Australia affirms that current estimates suggest that more than 250,000 Australians have been infected with this virus. Moreover, an article by Holmes, Thompson and Bell 2013 also state an incidence of approximately 10,000 new hepatitis C virus infections occurring in Australia per year, with 95% due to the injecting drug use. Furthering the need of preventative initiatives.
Hi, I'm Amy Veal, and I'll be talking about why we chose to do our assignment on prisoners. Our population of prisoners was chosen due to its susceptibility to contracting the hepatitis C virus. We found this group to be vulnerable because they are in an environment where, in many cases, they use unclean needles to tattoo themselves and others. They also may use the needles to inject illicit substances into their bloodstreams. Prisoners have a very high level of drug use compared with people in other environments. This hugely increases the rate at which people can contract disease. The Department of Health have found that 38 per 100 males with history of injecting drugs entering Victorian prisons have incidents of hepatitis C. This is a huge amount. When inmates are in prison, they do not have the opportunity that a free man would have. They cannot look after their own health in the same way. Their environment is not clean, which results in transfer and creation of illness. Many prisoners have existing drug problems when they enter prison, and this is not suddenly stopped when they are arrested. This leads to illegal drugs being trafficked into the prison and being used and injected into inmates' bodies. Because this is done in a hidden manner, as to not get caught, the inmates use the worst practices involving multiple people sharing the same needle. As hepatitis C is transferred through the blood, they can possibly pass this disease on to many people if they themselves are infected. Not only do prisoners inject the drugs into their system, they also do self-tattooing on themselves and others. This is the same sort of thing, as the same needle is used to give multiple inmates tattoos, creating other pathways for blood-borne diseases to move from one body to another. Prisoners also live in confined environments, with many people living in small areas. This leads to a large range of different infectious diseases being easily spread. Also, with many prisoners living all together, people tend to be influenced by their surroundings, this meaning that there may be a person who would not normally involve themselves with drug use or personal tattooing, but since they are surrounded by it, they may feel inclined to join in.
Cassia, and I'm going to outline the health inequalities among Australian prisoners in relation to hepatitis C. One of the most health inequality amongst prisoners is access to health services. Although Australia's healthcare system is high class in both efficiency and effectiveness, there are inequalities. Access to proper healthcare is one of the issues experienced by Australian prisoners. Hepatitis C is highly prevalent in prisons, either affected through needle sharing or transmitted or spread through when the blood from a hepatitis C infected person enters the bloodstream of someone who is not infected, therefore making it one of the major risk factors and a big concern. In Australia, not all prisons have safe injection rooms and safe needles. Therefore, if prisoners don't have proper access to health services such as safe injection rooms, this can lead to poor care given to inmates. Spread of bloodborne diseases is a major concern. Approximately 31% of Australian prisoners are infected with hepatitis C. This is largely due to needle sharing amongst drug users, and this is mainly due to not all prisons having safe injection or needle syringe programs within Australian prisons. Access to medication is another health inequality. Hepatitis C is a dangerous virus that can lead to very serious illnesses. Hepatitis C can be treated by antiviral medications such as Declenza, Epclusa, and many others. However, if patients don't have access to these medications to cure their illnesses, and it is left undiagnosed and untreated, hepatitis C can cause cirrhosis, liver cancer, and even death, and the chances of mortality are very high. Systemic racism is another factor. Australia is a multicultural and multiracial country, and a transcript from Race Discrimination Commission says that approximately 34% of those non-English speaking background people experience higher levels of racism, whilst almost 2/3 of our Aboriginal population face racism every day. And this is evident among prisons, which can lead to not everyone having the equal access to medication, health services, and proper care. And thus, there is a possibility that not many can get access to safe injection rooms and needles.
I'm Rebecca, and I'm identifying the range of determinants and inequalities that contribute to hepatitis C infection amongst prisoners. The risk of contracting the hepatitis C virus is elevated within prisoner populations, particularly those with a history of injecting drug use. Due to a lack of education, they are not made aware of their risks to contracting diseases in the system, nor does the legal system have the funds to do much preventative work. With the main mode of transmission being via blood-to-blood contact, no vaccines currently available, and more than 90% of cases showing little to no symptoms, it is easily spread throughout prisoners, even to prison workers and their family. Tush's 2010 study found that in a cohort of 65% male and 35% female prisoners, 72% had prior tattoos as well as injecting drug use, suggesting higher risks through bodily fluids. He also claims there is a close relationship between injecting drug use with infection and imprisonment, with infection being associated with several risk factors such as female gender, tattooing, and injecting behaviours including sharing of equipment. A study by Hellard, Crofts and Hocking in 2002 found that females were more susceptible to contracting the virus, with 66% of females and 55% of males out of 57 prisoners testing positive. This could be because sexual activity, high rates of sexual assault and battery to females makes them more vulnerable to contracting infections. Similarly, in a population of 50,000 incarcerated from Australian prisons in 2013, it was found that approximately 8,000 individuals tested positive to the virus, yet only 313 received the appropriate treatment. As discussed, it is clear that there is a wide range of determinants that contribute to the elevated risks of hepatitis C among prisoners, from unhygienic drug injection to assault among inmates, all pointing back to the main mode of the bodily fluids.
I am Letitia O'Regan, and I will be discussing one determinant and how it relates to the spread of hepatitis C amongst prisoners. The spread of hepatitis C virus is most commonly transmitted through blood-to-blood contact. This happens due to sharing drug-injecting equipment, the use of unsafe or unsterile needles, receiving blood transfusions that have not been tested, sexual transmissions, and pregnancy or childbirth, as the mother could have possibly transmitted the virus to her child. The proportion of prisoners who tested positive to hepatitis C was 31% in 2015. This was due to increased use of unsterile injecting equipment and the sharing of tattooing and piercing equipment. Prisoners tend to choose to take part in such risky behaviours, and therefore behavioural determinants are quite important in the spread of hepatitis C amongst prisoners. Prevalence of hepatitis C grew with age of prisoners, with 12% of ages 20 to 24 rising to 37 for ages 30 and over. This was due to the association with injecting substances and the number of years spent injecting. Behavioral determinants such as risk-taking behavior that result in the contraction of hepatitis C can be harmful to an individual's health, mentally, socially, and physically. Hepatitis C has a stigma about the virus associated with risky behaviors such as drug abuse and partaking in unprotected sexual relations. A study on the effects of hepatitis C virus on health showed participants experienced feelings that they described as shame and disgust about contracting the disease. This can cause stress on mental health, as contracting the disease can cause an individual to lose confidence, and therefore as a result, a person may isolate themselves from friends and family due to the embarrassment, leading to poor social health. Hepatitis C will also affect your physical health by contaminating your blood, causing health issues. Symptoms can include fatigue, nausea, loss of appetite, and yellowing of eyes and skin. This shows that the risky behavior can affect your health in many ways. Thank you for listening.